I'm Dr. Hillary from Rangeline Chiropractic. I wanted to talk to you a little bit about the ChiroThin weight loss program that we now offer at the office. I've personally done the program twice and have lost 55 pounds this year, almost 60. So being someone that's gone through it, I have been doing really well coaching and educating other patients. Currently, we have almost 20 people that are either doing it right now or have done it and seen great results. So I just wanted to give you some little information about it. It is a doctor-assisted weight loss program, so we're in contact every day. There's a portal online that you log into and that you and I communicate through. And then we also try to meet every 2 weeks because for most of us, it's the accountability that is lacking with other diets. And so I prefer to have everyone come in every 2 weeks or so. We can do a Zoom call, but you looking at me and telling me you have or haven't been doing what you should do or what I can help with, it does help seeing person to person. But if it's a distance thing or due to like the weather, etc., illnesses, I'm happy to do it over the phone or Zoom, but prefer in office. So the first visit, we would do a scan that's going to show your weight, your BMI, your percent body fat, percent muscle, and visceral fat. And then we'll go over the program. It comes with books, it comes with recipe guide, and it comes with these drops. Now, these drops help boost your metabolism and let your body burn its own fat. So that's what's so great about this program. There's no drugs or anything in there that we shouldn't have in our bodies. And there's intermittent fasting. So after dinner, I don't eat again until lunch the next day. My body loves that. I've been doing that since May. So 6-7 months now. It's been going really well. So you eat a portion control of food and you eat lean meat, vegetable and fruit for lunch and dinner. And then there are some what we call like free foods, which if you needed a snack, like my favorite free food is cucumbers with salt on them. So the program is for 42 days of being specific with your diet and taking the drops. And then 4 weeks after that, there's no drops and we introduce food again. So let's say you wanted to start eating breakfast again. Then we're gonna gradually introduce eggs and breakfast back into your diet. And let's say you want to add carbs now or dairy. Those are the things that we'll start gradually adding in, but we wanna keep your body and your metabolism in a burning state. And so we're gradually gonna keep it, and you can continue to lose weight after the 42 days. It's really cool. It's not as fast, but my first round, I lost 39 pounds in 40 some days. So that's pretty amazing, right? What's great too is that the program's doable. There's no shakes or anything or a whole bunch of supplements. It's just the drops. And these drops don't taste like anything and they don't have a texture. So I was really happy about that. And I tell people, if I can do it, you can do it. I don't even like things like this, but I gotta say the main reason I did it is because I hurt my foot in CrossFit, and it just wouldn't heal up, and I was getting so aggravated, and here I am trying to work for 11 hours a day as a chiropractor, and I knew deep down it was probably due to inflammation and probably all the carbs I was eating in my diet. So with this program, you're not getting the carbs in, you're getting the calories like that you barely need, and you're gonna burn off everything. Now you cannot do intense exercise with this program, but for me, I was like, that's fine, I'm done. But you can do yoga and walking and biking and stuff, so we can talk about that as needed. But what I really love for my patients is that a lot of us are inflamed, whether we have like an inflammatory disease or we have joint pain or muscle tightness and soreness all the time, and we've tried other things and it doesn't work. So this program is great for someone like you. If I've talked about something and you thought, you know, that's kind of like me, this program works. The only person I think that this wouldn't work for is someone who was more vegetarian or vegan, because you do have to have the meat. It's lean meat. There's a whole list of them that you can have. There's a whole list of all the different vegetables and fruits. So if you don't like broccoli, then fine, don't eat broccoli. Eat something else on the list. Like, I don't care. If you won't eat blueberries and you're allergic to strawberries, or I mean, just pick something else. It's a very flexible program. And then I can help if you're bored with certain foods or what to eat or what to drink. You do need to drink a lot of water. So we can talk about that too. I have lots of tips after doing it for so long and helping so many people. So I stress, reach out to me. Like if any of this is sounding like something that you've been dealing with, especially the joint pain, I know how it feels, literally. So I'd love to help. It was the first 2 weeks after it is when almost all my foot pain went away, and I had lost over 10 pounds. And so when you lose that and you feel good, you're more apt to keep doing it, right? So it's that quickness that I need results. And I mean, that's our society, right? We want quick results. We want to see it. And with this program, you can. And I know it's restrictive for 42 days, but I say you can do anything for 42 days. It's not that hard, right? So don't eat the sugar and the candy and the carbs for 42 days, but then, you know, lose 30 or 40 pounds. I bet you'll feel a lot better, and you won't want to go back to eating the bad lifestyle of food because you'll feel so much better. Honestly, it's been a game changer for me and a lot of my patients. So reach out to me. Dr. Hillary has showered.